everybody. Dr. Earl Stephenson Jr. here, Atlanta board certified plastic surgeon and founder of ESJ Aesthetics in Dunwoody, Georgia, where confidence takes shape. And today I want to touch a little bit about uh, sort of an innovative technology that's been around for maybe a couple of years and starting to come to the forefront. One, it's called exosomes. And exosomes are something that is used in skincare. So, what we're going to talk about, is it a breakthrough? Is it technology? Is it innovation? Or is it just plain old hype? Get into it. What are they? It's a hot buzzword. It's hot in skincare, but they are basically powerful messengers. Tiny little messengers that promise to do a couple of things. They promise to reverse aging, they promise to speed up healing, and they promise to give you glowing skin. But the question always is, do they work? Or are we falling for kind of a futuristic hype in a very fancy, expensive bottle? So, exosomes, as I'm going to bring this up, this is a great illustration, I think, are microscopic bubbles released by stem cells. They actually act like delivery trucks, small, tiny. Remember the Tonka trucks as a kid, and maybe I'm dating myself, but tiny delivery trucks that carry instructions between cells. And so, what does that really mean? They're designed to tell your skin, those dump trucks are designed to deliver information to your skin to do a couple of things. They're trying to tell your skin to make collagen, they're trying to tell your skin to calm inflammation, and they're also trying to tell your skin to repair any damage. So it sounds great. Tiny little microscopic dump trucks that deliver information to cells to make your skin healthy and glowing. That's a good thing. The best part of that is they're not living cells, so there's no sense or risk of rejection or complication. So these exosomes are not really standalone procedures or standalone treatment. Typically, they are combined with serums and applied after treatments such as microneedling, which is just penetration of the skin to stimulate collagen, or even after laser ablation or laser resurfacing of the face to enhance and boost recovery as well as a result. So that's the upside. Research has shown that these little dump trucks can improve skin texture, can help with pigmentation, and can reduce the downtime after treatment. So all good stuff. Patients, kind of anecdotally or just by their own experience, report faster healing, less redness, and just kind of an overall better appearance or glow. And I hate that word, but appearance to their face and skin. That sounds sweet. It is pretty impressive. And I'm not knocking it, but that's the glamorous side. So what are the potential downsides or the flip side? The first big thing is exosomes are products that are not FDA approved for skincare use. You ask, well, why not? Why not? Well, really, because it's a little bit of the wild, wild west. It's not a streamlined product. And so the quality from different makers or manufacturers differ. So most pharmaceutical companies that produce exosomes don't even tell you really where they come from, which is a little bit scary. So where can they come from? They can come from humans, of course. They can come from plants. And then they can come from, you know, who knows? Some of these little dump trucks from manufacturers may not even contain or have viable exosomes at all. And here's the kicker: if you get one of these lemons or these dud exosome kits, they could just sit on your skin, and there's a good chance they just will dissolve or break down before they do much of anything to the skin. So the question is, it all sounds great, So, are exosomes the future of skin regeneration? Possibly, maybe. But right now, they are best used kind of as a booster. They're not a miracle in a bottle, for sure. And we're just trying to make sure that they come from a trusted source. So when you go and you talk to your plastic surgeon, you talk to your dermatologist, you talk to your esthetician, and you ask about this, or those practitioners recommend it, you've got to make sure that those practitioners know that they come from a really trusted source so that you make sure that you're getting actual exosomes to help your recovery, help your boost your results. So again, exosomes are not typically a standalone procedure. They are paired with solid skincare plan. And now let me just kind of back this up. That means retin-A, some type of retin-A. That means sunscreen. That means sunscreen. That means sunscreen. I didn't skip sunscreen, retin-A, a moisturizer. And then if you have a professional skincare plan from your plastic surgeon, your dermatologist, your facial plastic surgeon, your esthetician, then exosomes on top of that with the appropriate skin treatment can be a good measure. So remember, because real results happen only when innovation meets clinical expertise. So keep that in mind. And that's how I do things here at ESJ Aesthetics. We are curated with confidence. So that concludes today's brief topic I want to bring to you about exosomes, kind of innovation in plastic surgery. If you have more questions or interested in having discussions about exosomes, about our talk today. Hopefully you enjoyed that. Hope you got a little bit out of it, and look forward to seeing you soon in the office or back here on my social media channels. Take care.